Now, I mean, I think one of the beauties of this medication is that there are no known clinically meaningful drug interactions. You know, even for some of our patients that have got chronic illness, for example, you know, those people that might be taking, you know, medications like warfarin, no dosage adjustment is required for those types of co-administered drugs. And so this is written on the product information leaflets, the CMI, you know, in the medication box. It goes through minimal metabolism, and most of it's, you know, eliminated unchanged in the urine, almost no hepatic metabolism. I mean, a couple of things to watch out for, you know, which is that it's substantially excreted by the kidney. So people with severe renal disease, they just may need to reduce their exposure a bit to this medication, basically just halving the dose. That's, again, that's something for the doctor to take on board, but that is certainly what's written in the TGA guide for this, or the product information leaflet. So there are reports of increased intoxicating effects of alcohol. I'll talk about that a little bit more in a moment. Does it cause serious neuropsychiatric symptoms? I mean, I think this is one of the key issues. It's always been floating around with Champix, and it still is today. I mean, you hear this story all the time, that, you know, look, you know, these stories can occur in people that either have a pre-existing mental illness or those that don't. And you kind of hear these stories that, look, I've taken this medication, I've just completely lost the plot, or I've just felt really unwell mentally, I just haven't been myself. You know, some people have said it's caused severe depression in their family members or in themselves, or, you know, even to the extent of, you know, feeling suicidal. So, you know, this is something that's been around since the start of access to this medication. And it is true that, you know, this has occurred in some people with or without mental illness. So there was a large study undertaken to address this issue a few years ago called the Eagle study. And I think the first thing, before I show you some results of this study, was to just always think about some of the alternative causes for these, or explanations for these kinds of symptoms. We know that nicotine withdrawal will cause these kinds of symptoms. You know, some people get quite anxious, depressed, stressed, not sleeping well, you know, when they stop taking, when they stop smoking. And that's to be expected. And those symptoms can hang around for a couple of weeks, particularly prominent in the first few days. Maybe it's the effects of other medications following quitting, because we know a lot of medications will work a lot better, even though people are taking the same dose when they stop smoking, because of a reduction of the polycyclic aromatic hydrocarbons. So we know when you remove that from the equation, medications just generally work better. So in other words, are we getting kind of this kind of inverted commas overdose type symptoms of medications that they'd normally be taking? Or maybe, and I certainly heard this as a clinician when I was a clinician for Quitline, you know, and I was there for many years as a clinician for Quitline. You know, sometimes if you just pry a little bit, you find out that they've just split up with a partner, or someone, you know, someone's died or something, or maybe they've had a car accident. They just, you know, just happens to be, you know, some other external event that might be causing these kind of symptoms, or, you know, maybe it's a combination of all these things. So the largest ever trial that looked at this, the Eagles trial, found no significant increase of risk of serious adverse events in the general population and for those with mental illness. And I'll just show you this here. You can see here the Eagles trial for those in the general population. Big numbers in each arm. And what we can see here for moderate to severe neuropsychiatric adverse events was that, you know, there's very little difference between the two groups, between Champix and placebo. You know, the overall numbers were very low anyway. In fact, you're more likely to get a neuropsychiatric adverse event if you're in the placebo group. So, but the telling point with all of this is the outcomes. You know, you're just much more likely to quit with Champix compared to placebo. And in fact, with the population that were studied with those with a pre-existing diagnosis of a mental illness, the moderate to severe neuropsychiatric adverse events was still very low, certainly not as low as the general population, but quite low nonetheless. In 2018, the RACGP, suggested or said that clinicians should monitor for changes, as we always should, advise prompt reporting of adverse events, but the risk does not appear to be greater for those taking Champix. So any populations that shouldn't be using it, well, we don't know much about pregnancy, we don't know much about young people. Safety and effectiveness in these populations hasn't been established, and so it's not recommended for use as per the TGA guidelines 2018. So, although, mind you, though, there was a fairly recent study that showed that Champix did not cause any increased adverse events in pregnancy, but it's really unknown. We just haven't got enough data to know about that, and certainly not recommended